Welcome. In previous lecture, we discussed what is cancer, what it comes from, and where it starts in the body, and the different types of cancer. In this lecture, we start speaking about the different type of common cancer, and we start with the lung cancer. The most common cancer, new cases diagnosed globally, the breast cancer and the lung cancer are tied for the most common, with each contributing around 12% of the cases diagnosed in 2020, according to statistics of the WHO. In men, lung cancer takes the top spot, contributing to over 15% of new cases in men globally. Lung cancer is a malignant tumor that begins in the lung. It's leading cause of cancer death for both men and women in the United States and around the world. Lung cancer develops when cells in the lung grow uncontrollably and form tumors. Lung cancer develops when cells in the lung grow uncontrollably and form tumors. These tumors can invade healthy tissues and spread to other parts of the body. When spread to the other parts of the body, we call it malignant tumor, and its metastasis to other. There are two main types of the lung: non-small cell lung cancer. This is the most common type of lung cancer, accounting for about 80% of all cases. Non-small cell lung cancer can be further classified into different subtypes such as adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. And the other type, small cell lung cancer. This type of lung cancer is less common than non-small cell lung cancer, but it's generally more aggressive, often spread to other parts of the body at an early stage. The main cause of the lung cancer is smoking tobacco. In fact, about 80% of lung cancer deaths in the United States smoking. Other risk factors for lung cancer includes exposure to second-hand smoke, radon gas, and asbestos. The symptoms of lung cancer can vary depending on the size and the location of the tumor. However, some common symptoms include a cough that doesn't go away, shortness of the breath, chest pain, blood coughing up blood, wheezing, unexplained weight loss, fatigue, loss of appetite. The most common cancer that I introduced to you, let's talk about the lung cancer. The lung cancer site in the chest, the lung site in the chest and deliver air or oxygen to the blood. Lung cancer is the most common cancer in men and women. Approximately 220,000 diagnosed per year in US. Somewhere between 1.1 and 2 million people are diagnosed worldwide with cancer, and it's an extremely lethal disease. The leading cause of cancer is approximately 160,000 deaths per year in US and 1.3 million worldwide. Lung cancer, as we mentioned, the early detection and the treatment is essential for improving the chance of successful outcome. This is a key point for successful treatment of the lung cancer. Treatment of lung cancer depends on the type and the stage of the cancer, as well as the patient overall health. Treatment options may include the surgery, chemotherapy, radiotherapy, and target therapy. We do a very poor job of being able to cure lung cancer because by the time it's diagnosed, it's too far advanced to be treated. Locally, for cure with surgery or radiation, it's a lethal disease. There are many subtypes of lung cancer. but 85% of them are called non-small cell lung cancer. They come in various histologies. Adenocarcinoma is the most common, 40%. Then squamous cell carcinoma and large cell carcinoma. As we mentioned before, what are the risk factors? We say smoking. Let me repeat, smoking. 87% of the lung cancer deaths in the men and 70% women are likely caused by smoking. The risk of developing lung cancer is 25 times higher in a smoker as compared to non-smoker. Risk of developing lung cancer is 25 times higher in smoker as compared to non-smoker. Many other lung cancer are linked to second-hand smoke. Let me repeat the number. One risk factor for lung cancer is smoking. Primary smoking, secondary inhalation of smoke when you are exposed to it. That's why everywhere smoking has been banned. Restaurant and public places. Stop smoking. Don't let yourself be exposed to second-hand smoke. If you can decrease exposure, wearing air mask. If you are uranium miner, you can decrease your chance of developing lung cancer. To prevent lung cancer, many studies have been done looking to try to understand how can we screen for the lung cancer. Many things have been tried, and including X-rays, computed tomography scan, and sputum test. Who should get lung cancer screening? The United States Preventive Service Task Force recommend annual screening for lung cancer with low-dose computed tomography for adult ages 50 to 80 years who have a 20 back year smoking history and currently smoke or have quit within the past 15 years. What is the low-dose CT? Low-dose CT is a type of X-ray that used to lower dose of radiation than traditional CT scan during an LDT. You lie on the table while an X-ray machine rotates around you, taking a detailed picture of your lung. The scan only takes a few minutes and is not painful. Lung cancer is the leading cause of the cancer. According to the American Lung Association, the average lung cancer 5-year survival rate is 80.6%. Only 16% of lung cancer are diagnosed at an early stage. More than half of people with lung cancer die within 1 year of being diagnosed. While treatment of more advanced stage cancer with target therapy, immunotherapy have come a long way. The best tool in the fight against cancer is early diagnosed through low-dose CT screening before symptoms appear. Symptoms occur mainly in late stage lung cancer. The best way to find early stage lung cancer is by enrolling in an annual screening program. And this is Dr. Claudia, a radiologist and the expert in this field, and this is its website. There was a large study called National Lung Screening Trial that looked at men and women 15 to 74 years old who were or otherwise in the good health, who had at least 30 back year smoking history. That meant they smoked at least 1 pack of cigarette per day for 30 years. That means they have 30 back year smoking history. If they have smoked half a pack a day for 30 years, they would have a 15 back year smoking history. And this is the other sites you can see. If a man or woman meet those criteria, it was noted that they would be screened with a CT scan yearly for 3 years in a row to look for early lung cancer, and that is could actually detect lung cancer and remove them before they become lethal. Annually, check for the smoker. This is the best practice for early detection of the lung cancer and early treatment. This is for this lecture, and thanks for watching, and see you in the next lecture.